61-year-old male, slight hyperglycemia, cervical resorption number 2, it's the second molar in my world, large defect. The dentist actually was planning to try to restore that tooth. And he got to me through a friend. So if we look at this as a very large periapical lesion, and cervical lesion, not a whole lot of alveolar bone. The roots occupy most of the alveolar housing, and there's a pneumatized sinus above that, or pneumatized ridge above that. So once again, we decided to plan the implant in the ideal position, hopefully engaging the septum and what was left of the interfurcal bone. And we place the implant, graft the socket with the same combination of autogenous bone plus DBBM. And I'm not sure this is a real reading or not. This ISQ of 3 of 17 is the lowest reading I've ever had. I suspect it may show that the pin wasn't completely engaged in the implant. But the question is, once again, what do we do? Let's vote.